Good morning and welcome to Norris Chiropractic. We have our patient here this morning that has agreed to participate in this video. Basically, is what we're going to do this morning is show you what we do at Norris Chiropractic. In a nutshell, is the way it works is I'm like a mechanic of the body. My job is to promote balance and range of motion by providing specific spinal manipulation adjustments to a restricted area of the spine. So Dee here, she has some past issues with her back. She has a prior history due to some cheerleading injuries and just stress and trauma from what she has done in the past with her cheerleading experiences. But today she's not necessarily in pain. She's here for a spinal checkup. I'm sure we'll be able to find some imbalances, and is what we're doing here on video is to show you how the adjustments work through trying to figure out where the resistance in the spine is and go into that area and restore a normal range of motion through a specific adjustment. So today we're going to start with her neck here. So we're going to have her flex her neck to the right, kind of checking just a global overall range of motion. We're going to go the other side. There's a little resistance there. So basically my job is to make her spine more flexible and move and work better. And in doing that, it's going to make her feel better overall, but it's also going to increase the longevity of her spinal soft tissues. So we have a little resistance right there. So we're going to go to that specific individual segment, and we are going to simply provide range of motion. Sometimes it can be a little uncomfortable to do an adjustment because you have to take the soft tissues and force them through full ranges of motion to get the bone to move and the joint between the bones to open up to allow the movement. Perfect. And now we're going to recheck her spinal range of motion. It should be better. There's still going to be a little bit of soft tissue tightness. However, the adjustment, what we just did, our therapeutic goal is to restore individual range of motion to the spinal segments of the neck. And it feels like we accomplished that. We're going to move on to the middle part of her spine. So I'm going to have her lay face down on the table for me. This is a little harder to show on camera what we're doing, but basically your spine consists of 24 movable segments. We're going to go up and down this spinal region to try to figure out where there's resistance in the bone movement. Most people have a little bit of tension right here just because it's a high stress area. There's a lot of soft tissue guarding and restriction due to daily activity shoulder movement. If you want to stand over here, Becky, so you can get a better view of the adjustment. So we're a little locked up right here. So basically is what we're going to do is just force range of motion to this area. I want you to take a deep breath in for me and then blow it all the way out. Perfect. And we're going to go back and recheck to make sure movement was restored. And it was. Last but not least, we have the lower back region. A couple weeks ago, Dee was in with some imbalance in her range of motion. She was moving better on one side of her lower back than the other. Were you better after the adjustment last time? Did you feel increased range of motion?
Yeah, it was the right side that was tight and that we worked on loosening up.
Okay, yeah, I mean, does it still feel a little tighter on the right side compared to the left?
Yeah, still a little bit, but definitely improved after last time.
So the way we're going to check this is I'm going to stabilize her sacrum, and then if you want to kind of stand right over here for me, I'll kind of get out of the way, Becky, so we can kind of let our viewers see what we're doing here. I'm going to have her raise first the left leg straight back off the table. I'm going to help her just a little bit and checking the ranges of motion, and same with this side. Good. There's a little resistance. Right here is what we're checking is sacroiliac, which is the joint of the pelvis, basically where your sacrum and your pelvic bones join, and we're going to restore mobility to that. So Becky, if you just want to go right over there for me. Dee, I'm going to have you lay on your side, so this side is up facing me. So basically, to move a bone, you have to take that specific segment and force it to its in range of motion. So we like to call this the pretzel move, because we basically twist the lumbar spine up like a pretzel so we can get the spine to unlock and move. And then we're going to go to the other side. And Becky, if you want to stand over there for me, ma'am. And same thing, it's a little tighter right here. We're going to force through that tightness. Perfect. And get the adjustment to happen. We're going to stretch her hip joints. Trying to increase as much mobility as we can. One more. Perfect. Dee, I'm going to have you lay face down for me one more time. We want to check that hip extension. Make sure it is balanced. We'll lift this leg straight back. Better movement. Same with this side. Perfect. You're all set. And that's what we do here at Norris Chiropractic. Stay tuned for following videos.